You're welcome to our discussion segment on Good Morning Anambra Monday episode. My name is still Nonya, and I still have my colleague in the studio.
We say welcome to this discussion segment.
All right, Anambra State government is interested, and it has continued to reposition all the sectors of the state economy in order for a better service delivery, and health is part of the one that has the priority of the state government. The state government started by refurbishing hospitals, even in the remotest part of the communities. Health centers were repositioned for better health delivery. This time around, it's the Anambra State Health Insurance Scheme. It still gets towards better health for the Anambra. And this morning in the studio, we have the Senior Special Assistant to the Governor on Health Insurance and Pension. He is Mr. Dozie Okpalaugo.
Thank you.
You're welcome to the studio.
Thank you for having me.
You're welcome.
Thank you.
All right, Anambra State Health Insurance Scheme. What is this all about?
Basically, the Anambra State Health Insurance Scheme, ASHARE, the acronym ASHARE, basically encompasses the provision for a formidable and quality health insurance services, healthcare services for an enrolled population. When we say enrolled population, as far as the participants. So what Anambra State government is putting together from the Anambra, it's a channel whereby they can assess quality health care at more or less no cost to them for just being enrolled and participating in the scheme.
Who are beneficiaries, and then can you tell us the benefits?
The beneficiaries, as far as the scheme, is every resident of Anambra, indigents, working class, anybody that resides in Anambra. It's a beneficiary. It's a law that is, meaning it's mandatory for everybody to be part of it. So for now, we're kickstarting with the formal sector, which is more or less organized to say. So they have a pattern where we can already move in and synergize with them. Then afterwards, we progress to the informal sector, which comprises the private sector and people that have small businesses and individuals on their own that want to equally enroll on the scheme. So we're making progress.
All right. Tell us, now you talk about enrollment, and you talk about little or no costs for the enrollment. Could you let people know, to understand it better, how to enroll, and of course, what it will take them to get enrolled into the scheme?
Okay, when I say at as little as no cost to the Anambra, it's not entirely free, because even in Freetown there is no free lunch.
Free food, yeah.
So in this case, what the government has done is to check the indices, and that will result to a situation where the Anambra are not being taxed heavily or asked to pay heavily for health insurance. And in doing this study, we were able to narrow it down or peg it at as low as 28 to 30 naira a day for healthcare services. So if you put it together, if for 30 days you calculate 28 naira or 30 naira every day as what you put aside for your health, if you do a capitation or you put that together, you're having about 900 naira or thereabout 1,000 a month. That takes care of your health for the whole year. So if you do a payment of 30 naira a day, which when spread out, maybe you pay monthly, because we're making a situation whereby it's going to be done monthly. So in a year, you're paying about 12,000 naira for your health, whatever level of care. If you go to the hospital, if your bill comes out to 200,000, 500,000, the 1,000 naira that you've paid for the month covers that. All you do is just walk into the hospital, get the required services, and there you go.
Okay, yes, that's what I want to say.
All right. Sorry, we'll get back to you. All right, please, if you're watching and you want to know more about Anambra Health Insurance Scheme, The numbers are on your screen to call and ask any question. We have the right person in the studio to guide you through to what you can do to be a part of what is happening in Anambra State as regards our health insurance scheme. And of course, for the benefit of Anambra, please, when you call us, you can ask your question in Igbo or English for a better understanding of what is happening.
Actually, I was coming to that. Those people who are in the villages, from your explanation, you said, oh, Makande Anambra, and those residing in Anambra.
Yeah.
There are people who are in the remote areas, who are in villages, who want to access this.
Yes.
How is this accessible?
Okay, as far as for those people in the interior parts of Anambra, we've...
especially those who are not on a working class, they have their businesses.
Yes, the locals, because to a larger extent, this is even more designed for them. So we've segmented the states, the communities. We've done segmentation of these communities. So as far as the locals, in reaching out to them, we have a worked out plan that is going to be far-reaching when we launch into the market. And how are we going to do this? We're working with the PGs, we're working with the women unions, the town unions, the market women, and even the town criers in all these communities, because there is no community in Anambra State or anywhere in the world, in the eastern Nigeria, where you don't have town criers. And you need to see how effective these people are in dissemination of information. So we're using all these channels to reach out to them. So
what information can you give them to really get them access this scheme?
Yeah, the information we're giving to them, just like I rightly said when we started, is the benefits of the scheme, the cost implication of the scheme as far as how affordable it is, because we're looking at a situation, if you can actually buy a bottle of mineral for 50 naira or even 100 naira, compare that to your health for 30 naira a day or 28 naira a day, you definitely want to jump on it.
Government agbapego nyabo Anambra State Health Insurance Scheme. Mbapa ahụ I took kikowagodulu ndị Anambra na-ege ntị ma ebidogo mmebi ya na onye chọrọ ije maka ya kedu ebe ọ ga-ejegasị ka o wee nwee ike wee sonye n'ihe a na-eme.
Okay, thank you. Dịka kisi wee kọwa and ka isi wee fụ na ife onyonyo igosi kịta. The scheme Akaga launch here in the coming weeks. And when we say launching, we mean it to kick flag off the campaign. And so at this stage, if I know the confidence building stage of the scheme. So we've started with the ministries, the MDAs, and other government stakeholders. So when we're done with that phase, we now progressed with the shortlisting of hospitals, the healthcare providers, because I'm a pool of hospitals get provided this health for the participants that the scheme. So when they enrolled, you get one hospital, you get jakagi choose you, and if I now consider proximity, hospital did so to Ebengi Wabi, Imambi na Ibi na Agoka, each hospital in Northia, that's going to be expensive and time consuming for you in the case of emergency. So proximity is really considered in participants choosing their primary provider. So now looking at the screen, the shot you just portrayed now, and if we go refurbishing Naga on with the primary health centers and the general hospitals. So in as much as we are working more with the general hospitals and providing this care, because general hospitals, they are strategically positioned most communities. So, but in the event that these general hospitals are close to people, we also have private hospitals in these villages, because most villages are private hospitals. No, private hospitals now operate within the
yes.
Okay.
So we also have those people also being part of the program. So they will be working alongside, providing health alongside with the primary health centers and equally the general hospitals. So we have all that captured.
Okay, all the maimana on abo abiani here basalo health. ndị mmadụ ndị baya na-asị gọọmenti wepụtara anyị ihe ka anyị enjoy ya ka anyị esikwe bịakwa kwụbakwa ụgwọ n'elu ya ka ịkọwa kene mkpa ọ dị maka obele ego anwa isi na ndị mmadụ ga-akwụ ka ha nwee ike access health center.
Okay. You know, in all honesty, what we are doing, and if I may here, are different from what is obtainable in any other.
Okay, that's the world
best practices. Yes. So we more like lifted this from what the national body is doing, the National Health Insurance Scheme. So the National Health Insurance Scheme is a more holistic one. So what we did was to water it down and pattern the scheme to the way it's going to suit, that is suitable for the Anambra. So we took off a lot of things that wouldn't be sellable here and added the ones that are sellable in Anambra State. So it's market specific as far as if I met with the Anambra State Insurance Scheme. So we had to take off the HMOs. I will put HMOs, then was there the agency. So the agency acts just like what the HMO is doing for the national body. And again, we are partnering with a lot of development partners. We're currently talking with the United Healthcare Agency in the United States. They are so eager to come on board with us as far as the level of work we've done. And we're also partnering also with Blue Cross Blue Shield. That's the biggest healthcare provider in the United States of America, which means also the world. So they will be here very soon to also see the level of work we've done and see areas where they can partner with us to drive this scheme.
Why na-ere ogiri nọ n'ime afịa na awụ isi wabịa ojeje na kemis ọsịa mixere m ọgwụ o wee 100 naira tikekọ esi ghọta this scheme na ọ ga-abala ya uru so that ọ nweta uru tenkobo oje tinye ya na ya so that mgbe ọbụla
and encourage ndị Anambra ka ha wee ghọta mkpa ọ dị.
Okay. In that essence too, in preaching this, letting people about healthcare, you mentioned about why not we also, are discouraging people from self-medication. So these are the things the scheme also covers, because when you get to the hospital, your being a participant also covers your prescriptions as well.
Sorry, at this point, for want of time,
okay.
This is where we stop in for now.
Okay.
To enable us to do some other things.
Oh,
We'd like to thank you so much, Mr. Dozie Okpalaugo.
Thank you.
The Senior Hospital Assistant to the Governor on Health Insurance and Pension. Thank you for your time.
And thank you for having me.
Yeah, thank you.
Thank you.
All right, thank you so much for your time. Join us at the other side of 8, right after now, for the next discussion segment. Don't go anywhere.